give us an example of if there is one at the top of your head, of a concern, of a case where someone's medical records weren't properly guarded.
The mechanism to track that right now rests with the Office of Civil Rights, which is part of Health and Human Services. And there's been, I think, 24,000 reports, and not one single violation or penalty has been assessed.
It's just an absolute joke. There's absolutely no enforcement in this whole thing. I've gone through it myself, and now we're going to start this NIHN thing where we're going to get everyone's health information and put it in a giant network databases where there's absolutely no security, no oversight. It's an absolute joke.
If your data has been misused, or if they think there's a violation or breach of the Health Information Portability and Accountability
And
Act.
let's figure out when you say my
Health
data,
insurance.
what's my data?
It could be anything. So one really touching example is a woman whose mental health information was sent along with the entirety of her medical record, and that piece of it didn't need to go to get the care that she needed. And now she is completely unable to get that piece removed from her medical record. So every time that medical record gets shared with another institution, they also have her mental health history.
And she doesn't want that?
She doesn't want it. She's tried. There was an article in the Wall Street Journal a couple months ago about her, and she's tried every means of recourse she has, and she can't get anybody to change it in the system, in part because the law affords her no protection and no recourse.
And then you have hospital systems that are going to be sucked into this, just like the Adventist health system, who's proven in different court cases that they don't feel federal rules apply to them, that they're above the law because they're running under some church organization. It's an absolute joke.